Hello everyone, I'm Dr. Jong from Lih-Ren Clinic. This is a picture on my forehead taken 2 weeks ago. Can you see the great difference? My wrinkle improved a lot. I don't have any operation. This is the result of non-surgical. The result of botulinum, toxin, and hyaluronic acid. In this video, I'm going to introduce the difference between toxin and hyaluronic acid and how I rejuvenate myself with this material. Wrinkles are divided into dynamic wrinkles and static wrinkles. Dynamic wrinkles refer to wrinkles that appear after facial expressions. For example, the cloudfish that appear when smiling. Static wrinkles are the wrinkles that are already present without any facial expressions. Let me explain. When I raise my eyebrow, my forehead muscle-frontalis-contract, so that you can see a lot of dynamic wrinkles on my forehead on the left side picture. The wrinkles that appear when doing facial expression are called dynamic wrinkles. Botulinum toxin is to paralyze the facial expressions, so that the muscle will not move after toxin injection. Resulting dynamic wrinkles improve. Some people often involuntarily frown. The people with frown wrinkles look unhappy and angry. It is caused by the contraction of corrugator muscles that are located between the eyebrow. To improve frown wrinkle, botulinum toxin is injected into corrugator muscle. Corrugator is paralyzed. Dynamic frown wrinkle is eradicated. On the left is the movement of raising my eyebrow and the frown before injection of toxin. There are so many dynamic wrinkles. On the right is after toxin injection. Toxin paralyzed facial expression. Dynamic wrinkles improve a lot. I use this paper to explain the formation of static wrinkle. Assuming this paper is the skin, if I keep folding this paper, finally you can see the fold on the paper. Facial expression is kind of folding the skin. The folded skin becomes thinner, pressed, and the wrinkle formation. We call the wrinkle as static wrinkle. The picture on the left is a static wrinkle that has appeared without any facial expression. The formation of static wrinkle is that the skin has become thinner. To smooth static wrinkle, we need to inject fillers under the wrinkle. Hyaluronic acid is the most used fillers. In order to reduce pain, we first apply topical anesthesia on the injection site and wait for about 30 minutes. This is a picture of me injecting myself in front of the mirror. Because of the topical anesthesia, there are only a little bit pain when the injection was given. The picture on the left shows the location of toxin injection. It hit the facial muscle. The picture on the right is hyaluronic acid injection site. Fill the static wrinkle with hyaluronic acid. This is how I look immediately after injection, and the needle holes are not obvious. If some people have obvious needle holes, they can be covered with cover cream on the next day. Otherwise, the needle holes will disappear within a few days. This is the comparisons before and after non-surgical. The entire forehead light up and the wrinkles are much less. In conclusion, for people with dynamic wrinkle but no static wrinkle, botulinum toxin injection is enough. People who have static wrinkle need toxin and hyaluronic acid to smooth wrinkle. Though the effect lasts about half a year, you don't need surgery. The recovery is very quick. They can effectively reduce your wrinkle. Are you interested in non-surgical? I hope the above instruction will help. Thank you for your watching.